So the results of this study with repository corticotropin injection are that in 116 people were started in the study, and 100 of them finished 50% of the study. And of those people, 61% or 61 patients who received repository corticotropin injection had low disease activity. And low disease activity is defined by a DAS28 ESR. So this is one of the ways that we look to see how patients have progressed. And in this case, 61% had low disease activity who had been given repository corticotropin injection. When I use it mostly in conjunction with DMARDs. So it is like, in most of rheumatology, you try to start out with the simple medications, of course, and then work your way up. And oftentimes you're limited by, if the medication, the next medication that you try, if it doesn't work, then you have to move up another step. And so this would be several steps up in the treatment paradigm. But it's good to have it as available. So, for instance, I might have 1,200 patients that I'm seeing at any one time, and it may only be a dozen of them that may be benefiting from this medication. But they're people that have been a challenge to treat. So it's good to have that tool available. Well, it'd be difficult for me to say if you would use it for a lifetime, because it depends on the patient and how long their life's going to be. But for long term, I certainly have used it in people for more than 12 weeks, for 3 months, 6 months, and perhaps even a year. But as with all medications, when a patient gets into low disease activity, I try to see if I can simplify their treatment regimen. So if somebody does get into low disease activity, then I would try to taper it and see if they would continue in that low disease activity.
Any adverse events, safety or toxicity issues?
In this study, there were adverse events. There were 10 people who had headaches. There were several people who had a urinary tract infection, pharyngitis, elevation of their blood sugar, which are common, side effects that can occur in patients who are on medications that stimulate, the adrenals to make steroid. So they're generally steroidogenic effects would be the type of side effects that you might see with it.
Any concern about infection?
Well,
risk for infection?
Sure. So there is always a concern about infection. For instance, patients with rheumatoid arthritis are more at risk for infection anyway, and then what you're trying to do is you're trying to lower their immune response, because it's their immune system that is attacking them. And so when you lower that immune response, you do increase their chances for infection. And in fact, there were 2 serious adverse events in this study. One was chest pain and one was pneumonia.